Hi, I'm Dr. Jomaa. Welcome back to my channel and this series on osteoarthritis. So far in the series, we've explored the clinical presentation as well as the causes of pain in osteoarthritis. In today's video, we're going to explore the hotly debated topic of the role of exercise in osteoarthritis. In particular, we're going to explore the role of underlying risk factors, which we'll soon learn have a very important role in this relationship. As always, please remember that this is general educational and informational content. If you've got any medical problems yourself, please be absolutely sure to go and see your own doctor. So why exercise? Well, let's get one thing straight. Exercise is medicine. In fact, it's widely regarded as one of the most effective forms of medicine going. The role that exercise plays in our general holistic health warrants its own series of videos, and be sure that they'll be coming soon. For now, suffice to say that exercise has been shown to promote longevity of life, improve our weight control and body composition, assist in the management of many chronic disease states, such as cardiovascular disease or diabetes, as well as improving psychological well-being and many other benefits still. Despite this, there remains a preconception that exercise or sport or even regular movement from our workplace-based occupations is potentially harmful to our joints due to repetitive loading or overuse, so-called wear and tear. In today's video, we're going to clarify this relationship, explore what the evidence base really says, and dispel some potentially harmful myths along the way. By the end of today's video, you'll have developed a much keener understanding of the relationship between exercise and osteoarthritis. So the first big take-home message is that the relationship between loading our joints through sport or exercise or what we do at work actually has a lot more to do with underlying risk factors than the exercise itself. Let's explore these risk factors and what the evidence base says about them. So first of all, we'll look at local joint mechanics. Local mechanical factors such as malalignment, which may occur due to muscle weakness or structural damage, such as injuring a meniscus in the knees, is shown to increase the risk of progression of osteoarthritis. This is due to a failure of load distribution within the joint. As a result, we have harmful shear forces or overload of vulnerable load-bearing surfaces. This harm is further amplified in obesity, where there's even more load to distribute throughout the joint. A simple way to illustrate this is to consider joint alignment, and in particular how joint alignment changes during loading. Studies have shown that patients with as little as 5 degrees varus alignment, which is bow-leggedness in the knees, can result in an up to 90% increase in the compressive forces of the medial joint spaces. This corresponds to an up to 4 times increase in the risk of developing signs of medial compartment osteoarthritis over an 18-month period. Similarly, valgus alignment, which is knocked knees, will increase the compressive load of the lateral joint spaces in the knee. And here, the risk of osteoarthritis increases by 5 times or more. Another crucial factor is muscle weakness, which can lead to instability of the joint. And this very often accompanies malalignment in a joint. If this instability is not addressed, then even simple exercises can exaggerate any underlying malalignment further and increase the risk of shear forces at the at-risk joint compartment. A number of studies have demonstrated a relationship between muscle weakness and altered movement patterns. Weakness around the joint will often present before the onset of pain, which further suggests that it is a likely causative or contributing risk factor to the development of pain and osteoarthritis. In the setting of muscle weakness, our joints are far less stable during occupational or recreational activities. On the other hand, there's evidence that exercises targeted to improve the dynamic stability of the knee can offer protection from the risk of OA in patients routinely engaged in loading activities which may expose unstable joints. Make sure you subscribe to the channel, as I'll be posting videos soon about the strengthening and stabilizing exercises which I prescribe to my patients and do myself to protect my joints. Another inescapable risk factor is the risk that obesity plays in osteoarthritis. Obesity is likely the largest modifiable risk factor for the development of osteoarthritis. And this has been proven in studies of knee osteoarthritis in particular. The relationship between obesity and the development of osteoarthritis involves a complex interaction of genetic, metabolic, and biomechanical factors. Obesity is a condition of chronic low-grade systemic inflammation with higher levels of circulating pro-inflammatory cytokines and, in particular, adipokines, which are produced from adipose tissue, which is another name for our fat stores. These cytokines promote ongoing inflammation of the synovium, which is a key cause of pain in osteoarthritis. What's worse is that inflammation in the synovium also promotes a catabolic joint environment. And this is the leading cause of the breakdown of cartilage in our joint. The increased mechanical forces that come with obesity are very significant too. When we load transfer, our body weight is transferred through our joints, and in particular through our hips and our knees. There is a leverage to this relationship. And so for every 1 kilogram more that we carry of mass, we increase the compressive load through the knees by 4 kilograms. The good news is that even small amounts of weight loss can lead to a significant reduction in the amount of load passing through our joints. Weight loss helps control metabolic as well as mechanical contributing factors to osteoarthritis. As a result, weight loss is shown to significantly reduce the risk of developing osteoarthritis, decrease the risk that an established osteoarthritis will get any worse, and reduce osteoarthritic pain in those who are symptomatic. I always find it's really important to start with these risk factors when talking about osteoarthritis with my patients. This is because I'll often see patients who've reduced their physical activities in fear of making their arthritis worse. These patients will often end up gaining weight, weakening their joints, and moving into an overall more inflammatory state. For those of you who are thinking ahead, you'll likely realize that exercise is an excellent intervention for osteoarthritis, primarily in its role in addressing these underlying risk factors, particularly muscle weakness, instability, and obesity. With that said, however, it has to be appropriately prescribed, and this is something we'll talk about in future videos. So in summary, in today's video, we looked at the key underlying risk factors which define the relationship between osteoarthritis and exercise. We found that worsening of mechanical features such as joint alignment and muscle weakness, which can lead to joint instability, are important underlying risk factors. We also explored the role of obesity and how it can perpetuate the risk of osteoarthritis through both biomechanical as well as biochemical and metabolic influence. When present, these risk factors will increase the risk that exercise will worsen osteoarthritis. And when absent, the likelihood is that exercise is more beneficial. In the next video, we'll explore in more detail how sport and exercise can influence the risk of osteoarthritis. In future videos, we'll talk about how specific interventions and strengthening exercises can help reduce the risk of arthritis and improve pain by strengthening muscles around the joint and improving alignment. If any of that sounds useful to you, then please make sure to subscribe. If you found this video useful, then please be sure to leave a like to support the channel. If you've got any comments or feedback, then please leave it in the comments section below. As always, if you've got any medical problems yourself, please be sure to go and see your own doctor. Until next time, stay healthy and stay active.